Okay. Let me just, grab those and then we can start.
Sounds good.
Okay. All right, everybody. So with us tonight, we have epileptologist Dr. Janelle Schneider. We're really glad that you were able to get your computer working. We understand technology is not always our friend.
No,
and that's okay.
No, it is not. And you know what, I'm going to say real quick too, I see my battery's running low, so I'm going to have someone grab my charger while I'm talking, so we don't have that issue.
No problem. All right. And she is, like I was saying, she's an epileptologist of Froedtert Hospital and the Medical College of Wisconsin. So I have her PowerPoint up and ready to go. I'm going to share my screen while she's doing that, and then we'll get started.
All right.
Okay. Can you see my screen?
I can. And I assume everyone else can then.
Okay. Wonderful. All right. The floor is yours.
All right. Well, after all of that, thank you all for joining us tonight. I'm going to be talking on about one of my topics that I'm most passionate about. So we're going to be talking tonight about epilepsy and mood disorders. So I gave a presentation about this over the summer as well. And if any of you caught that, I will be reviewing some of that same material, but I'm also going to be doing some other wellness related talks later on this year. So I saved a little bit of that information for us to talk in more detail about at future talks. Just gonna plug my computer in here. All right, so that's what we're gonna talk about tonight. You can go ahead and switch us over. All right, so epilepsy and mood disorders is something that has long been recognized as something that patients with epilepsy deal with. And depending on what study you look at, it's estimated that between 30 and 50% of patients, probably more than that, suffer from some kind of mood disorder. So not always, not just depression, but things like anxiety and other mood disorders. We know that when seizures are more poorly controlled, mood problems are more likely, and we'll talk a little bit more about that here coming up. And we know that suicidal thoughts are also more common in patients with epilepsy. Unfortunately, patients with epilepsy also have a higher incidence of death by suicide than patients in the general population. And when studies have been done to ask patients about their quality of life and what types of things or struggles that they have that affect their quality of life most, actually the presence of mood disorders is something that they rate as the #1 factor that affects their quality of life. Make sure I'm plugged in here. So we're charging. Okay, we should be good. All right. So when we think of depression and mood disorders, I think a lot of people think about sadness. And when I ask patients, are you feeling depressed? I think that's kind of what they look to, and they say, well, no, I'm not depressed because I don't feel sad. But there's depression and other mood problems can manifest with a lot of different symptoms. So it can manifest with symptoms of lack of interest. So you don't enjoy the things that you used to enjoy. Problems with sleep, that can be either sleeping too much or not sleeping enough. Appetite changes, worry, thoughts that kind of just keep racing and racing over and over in your head. Lack of energy and fatigue is another one. So if you're tired, you don't have any motivation, those can be symptoms of depression. And it can also be mood irritability. So where everything just kind of sets you off, you're more easily frustrated, those kinds of things. And then of course, crying spells, which is something that you might think of as being a more typical symptom. So when you think about having epilepsy, I think and you talk about things like depression and mood related symptoms, I think the first thing that people think is, well, you know, of course, people with seizures or epilepsy are depressed, because they have a lot of struggles. You know, epilepsy and seizures can lead to a lot of struggles that can be very difficult to deal with. So I've listed here kind of some of the things that might come to your mind as reasons why patients with seizures and epilepsy might be more likely to be depressed or have mood problems. I'm here.
Okay.
I don't know what just happened.
I don't know. Let me share my screen again.
Okay.
We will get through this.
Oh my goodness. All right.
Let me just open it up a little bit bigger.
Okay.
All right, can you see that?
Yeah, it's charging, so I don't know what happened. Oh my gosh. Well, let's hope we do get through this. Oh my gosh. Okay. So as I was saying, when you think about seizures and epilepsy and some of the struggles that patients have, of course, there's some things that come to mind that might create issues with mood. So when you have seizures, a lot of patients that have epilepsy feel socially isolated. They're scared to go out into public. They're worried about the possibility of having seizures in public. So that, of course, can lead to feelings of depression and frustration. There's a lot of fear that comes with having epilepsy for a lot of patients, worrying about when that next seizure is going to happen, what's going to happen with the next seizure. And of course, with some of those things comes lack of independence, being unable to drive, maybe not being able to have a steady job or income. And those things result in not feeling independent. And then, of course, medical costs. Seizure medications, testing, doctor's visits, all those things can be very expensive. And if you're not able to hold down a job, all of these things can create stress. We know also that some seizure medications can also contribute to side effects that may cause issues with mood as well. So there's all these kind of obvious things that pop up that are struggles that I'm sure many of you may be dealing with and can contribute to mood, but we're going to talk about some other things as well. Okay, so I'm going to kind of present to you guys, it's not that new of a concept, but it's a concept that's being increasingly recognized in the role of mood disorders and epilepsy. So what we know from studies that have been done is that there's a bidirectional relationship. And what I mean by that is we know that patients who have experienced psychological traumas or other traumas or stress are more likely to develop seizures and epilepsy. Patients who are depressed are also more likely to develop epilepsy. And the reason why that's important is because it demonstrates that there is this relationship where the two disorders can kind of contribute to one another. And what we also know is if you look at patients with epilepsy who have problems with depression, when they are having more issues with their depression or their mood, then their seizures are more likely to happen. And then when seizures are happening more frequently for those patients, they're also more likely to have problems with their depression. And so the two kind of seem to be cycling and interacting with one another. So the kind of new idea as far as looking at this is that there's again, this bidirectional relationship, and that epilepsy is, I'm always saying this to my patients, epilepsy is more than just seizures. So epilepsy and the mood-related symptoms are all part of the epilepsy. So I'm going to introduce this concept here too, because when neuroscientists who are studying these kind of interactions in the brain, when they started looking into, why does this happen? Why does stress have such an impact, stress, mood have such an impact on our brain health? What the leading neuroscience actually demonstrates the huge impact that our brain function and our brain health has on our whole body health. So many of you have, I'm sure, heard of the vagus nerve because we have this vagus nerve stimulator that we use for treatment of epilepsy. And it turns out that the vagus nerve, yes, it is a big nerve. It's traveling up to the brain. It kind of travels up to a control center area of the brain, and it affects brain chemistry and brain activity. But the vagus nerve is actually a huge network of nerves that connects our brain to all different parts of our body, our heart, our liver, and even our intestinal tract. So there's this kind of information superhighway that goes in between our brain and our body. And so even stresses that are happening at other places in our body can have an effect on our brain health and vice versa. So the whole system is kind of interconnected. And our brain health then has an effect on other parts of our body and what's going on in our bodies, infection, illness, those types of things also can have an effect on our brain health. And I'll be touching on some of these concepts too in the upcoming wellness lectures. But this is kind of where neuroscience is going, is this recognition of the interconnection between all the different things that we experience in our bodies. So treatment options for depression. So we'll kind of go through these one by one. Medications, of course, are an option for treatment of mood-related symptoms. The majority of antidepressant medications are safe and effective for the treatment of depression in patients with epilepsy. And there's one exception to that, which is a medication called Wellbutrin or bupropion. Now, there may be some patients with epilepsy that do okay with that medication, but in general, that's a medication we recommend avoiding because it can make the potential for seizures more likely. But the majority of antidepressant medications are safe and effective. There was kind of this old idea that maybe these medications and some of the neurochemical changes that they caused might make seizures more likely. But again, going back to this kind of new understanding of the mood being more a part of the epilepsy, that's really not how we think things work. So again, getting the depression under control is important for getting the seizures under control. So the most common type of antidepressant medication is something called a serotonin reuptake inhibitor. It's important to understand that medications can take some time to work. So if you start on a medication, know that typically it's going to be in the range of 4 to 6 weeks before that medication has benefit. Depending on the comfort level of your neurologist, you may need to see another provider or possibly your primary care physician to get a prescription for a mood-related medication. It really depends. Some neurologists are very comfortable with that, others maybe not so much. So therapy is another very beneficial treatment for mood disorders.
I think the same thing happened. There we go. There she is.
I don't know what is going on with my computer. I mean, I think honestly with COVID, I need to have an IT degree to manage all of this technical stuff. I apologize greatly. I really don't know what's going on. I'm looking at my computer. It's charging. I don't know. I'm sorry. I will continue. So therapy, I'm sure you've all kind of know the basic concept, but basically the description of therapy, you're meeting with a specialized provider. So this can be a number of different types of providers, but involves kind of sharing your thoughts, your feelings, and really it's a way to kind of maybe reframe how you approach things or stresses happening in your life, new ways to process emotions and struggles and things like that. So there's a number of different types of therapy styles. Again, there are a number of different types of providers that provide therapy. I always stress to my patients, it's really important for you to be comfortable with your therapist or your psychologist or whoever you're seeing, because if you're not comfortable, it's generally not going to be a very effective relationship, and it really needs to be in order for it to be beneficial. I mentioned here a specific type of therapy called cognitive behavioral therapy. So there was a study done using this specific therapy style that actually showed that it may be even more beneficial than medication in the treatment of mood-related symptoms for patients with epilepsy. I think one of the things my patients struggle with is access and transportation and finding the time for therapy. So sometimes they tend to opt for medication over therapy just because they don't have the time or the transportation. I think one good thing that's come out of COVID is that there really are a lot more options for virtual therapy, which for a lot of my patients has increased access actually. So that is kind of one good thing I think that's changed with COVID. I put in here a couple of websites that I'm sure we can forward on to anyone that's interested. But there are, I think, probably some maybe not so reliable sources, but these are three reputable resources, online resources for searching for therapists. So all three of these databases, basically you go on, you type in your zip code, and it will give you a list of therapists in your area, and a lot of times with a bio. So you can read a little bit about them and figure out if there's somebody that's in your area that's a good match for you. The other thing I didn't put on here, but is another resource, is talking to your insurance provider, because sometimes they'll have a network of individuals, and that's a good place to start as well. So I'm just going to touch on this a little bit because I'm going to be doing another talk about this in the coming weeks. But there have been a number of, probably you guys have seen this word mindfulness all over the place now. It's kind of a big buzzword. And it's actually being studied for medical benefits for a number of different medical conditions. But so mindfulness and meditation actually has been studied in patients with epilepsy as well. So mindfulness or meditation, really in a simplest description, are exercises or techniques that we use to kind of quiet the mind. From a neuroscience perspective, what a lot of these exercises do is they kind of stimulate our brains in a way that there are actual chemical changes and even physical changes that happen in the brain in people who engage in these types of exercises that have a lot of benefits for our brain health, can change brain chemistry, actually improve volume of brain tissue. And going back to that kind of information superhighway, again, the general thought is the healthier our brain is, the healthier our bodies will be, and vice versa. So some techniques that you may have heard of are some, relaxing breathing techniques. There's a number of different breath work techniques that can be used. There's something called progressive muscle relaxation. There's various guided meditations. All of these things can have the same kind of benefit for your brain. Studies have shown in patients with epilepsy who regularly engage in these types of practices, there can actually be improvement in seizure frequency. It can help with the mood-related effects And there's actually some studies that showed improvement in cognitive performance. So in those tasks like memory. And I already mentioned the brain volume benefits. So again, these things have become more accessible as well to patients kind of in this virtual world that we're living in right now. So, oh, we made it. Okay, so take home points. I think important to recognize for everybody, patients, family members, doctors, that mood disorders are a big part of epilepsy, and they are truly a part of the epilepsy, not necessarily a reaction to what those patients are experiencing, although that likely contributes as well. We are kind of shifting to this idea in medicine of the brain-body connection and recognizing that things that have an effect on our body can have an effect on our brain and vice versa. And that's going to likely lead to a lot of other interesting treatment modalities in the future for things like epilepsy and other neurological disorders. So I kind of already touched on this, that bidirectional relationship. And the most important thing, I think, is recognizing that there are treatments available that can improve the mood-related symptoms. It's important to talk to your neurologist. And this really should be part of your routine epilepsy care because, again, we know that it has benefits beyond just helping you feel better. It can improve your seizures and your epilepsy as well. So that was a rough start. So we made it.
Thank you, Dr. Schneider. Thank you. So now is the time where we can do a Q&A.
Okay.
But Dr. Schneider, I'm going to actually put the slide up that had some of those resources just for a few more minutes. Was it this one? Yeah.
Yep.
Just while we do a couple questions so people can write those down if they want to. So feel free to, you guys can submit your questions. And then just remember, you can also use the Connect email that we talked about if you think about something after the fact. John typed that in the chat. So it's connect@epilepsywisconsin.org. So Dr. Schneider, going back to the resources, you mentioned a couple times, there's a wealth of information out there. What would you recommend to somebody, something that's reliable versus maybe it's not the best information, if that makes sense? Is there a way to kind of distinguish between, like that's, medically researched versus that's just someone typing that, you know what I mean?
Yeah. So, I mean, are you talking about information in general or information about depression?
I guess information about depression. Yeah.
Okay. So of course I'm a little biased, but I would say a good place to start would be talking to your doctor. I think, as doctors, we generally have a good idea, especially within our specialty, what the reliable sources are for information that patients might be asking about. And I'll give you guys a little plug, but I tell all my patients to start with epilepsy.com because there's, information there about every possible thing you could want to look up. And so that's always a good place to start. As far as, related to depression and epilepsy in general, I think I would start with talking to your doctor. I don't know that there's, a good website other than the Epilepsy Foundation website to look at for that information. You guys have a ton of really good information there. And then I think if you want to take it a step further, talking to your doctor.
Yeah, definitely.
And if you find, that's not to say that there isn't reliable sources out there that I'm not aware of. So you can always take what you found and bring it to your doctor and then have them take a look at it and tell you whether they think that's good information or not. We're generally pretty good at being able to pick that up.
Yeah. Great. Thank you.
Yep.
Can you mention some, what apps might be a good place to start for the mindfulness that you were talking about?
Yeah, well, so there's a number of them out there. I feel like every time I look, there's more. And I think one of the great things about mindfulness exercises is there isn't a bad mindfulness exercise. So what I tell my patients is find something that feels comfortable for you. There are a number of apps. I mean, I can list them off for you. There's 10% Happier, there's Headspace. I just saw another one the other day. I cannot think of the name of it. But from what I looked at least Headspace and 10% Happier. There are also a number of free resources out there where you can at least have access to some simple guided meditations or breathing techniques. The apps a lot of times will come with a membership cost. So there's that. But again, it doesn't, the benefits really are pretty broad across all different types of techniques. So I think the key is finding what feels comfortable and what's easy for you. It doesn't have to be anything real complicated.
Right. And I know if you whether you have an Android or an iPhone, I think you can just go into the App Store or Play Store or whatever it is on your phone, and you can type in mindfulness and a bunch of stuff will pop up. And usually there's a description. So I think that's also, but yes, the membership thing, they usually have you try it and then then
you got to watch for that free 14-day period.
So you'll get charged. A couple more questions. It looks like, can depression and or epilepsy improve while the other disorder doesn't?
Meaning depression gets better, seizures don't get better.
I'm assuming. Yeah.
Okay. Well, so I would say that there probably are times that happens. And so I think it's a little complex. It's maybe not always a direct, cause effect thing. Let's treat your depression and your epilepsy for sure is going to get better. I think the key point is understanding that first of all, our moods come from our brain, seizures come from our brain. So it's all kind of part of the same neurological condition, and they have an influence on one another. So you always want to have both as good as they can be. So working to get your seizures as good as you can be and working with your doctors to get your mood as good as it can be, because they do have an influence on each other and the rest of your health in general too.
Yeah, that's true. Thank you. Are there specific types of therapists that are best for patients with epilepsy?
Well, I touched briefly on cognitive behavioral therapy, which is one type that's been specifically studied, but it's important to know that there aren't studies out there looking at every specific type of therapy. So there probably are a number of different therapy techniques that are beneficial. I think probably the most important thing is finding a therapist that you feel comfortable with. And that you feel like you can have a good relationship with, and then give it some time and, kind of have a set point for yourself. Like in a couple of months, I'm going to do a little check-in and see if this seems to be working for me, if I'm making some progress with this person. And if you aren't, then it's probably time to find somebody. I mean, you might know that right away, but I would say, do a check-in at some point and, be honest with yourself about whether you think that relationship is working and it's helping you get to where you want to be. And if it's not, then it's probably time to find somebody different.
Yeah. And it's okay if it doesn't work, the first time or two, right? Because like you said, you really want to make sure you're comfortable with that person.
Right. Yes, definitely.
Wonderful. Let's see. Is somebody typically going to be prescribed an antidepressant before any of these other therapies or meditation or anything is tried? Is that typically the first step?
Well, so I can't speak for other doctors, but I can say for my patients, we usually have a discussion, if we identify that there's a mood-related problem happening, we have a discussion about what things can help. And then I involve them in the decision of, what sounds good to you, what's going to be doable for you. Is therapy going to be something you can commit to? If not, maybe we should try medication. You want to try some lifestyle things like mindfulness and meditation, and see if that improves things, then we can go that route. I think it's really up to the patient to decide what's going to work or what sounds best for them in the beginning. And then of course, you can add on other things if you're not getting the results that you want.
That makes perfect sense. Yeah. John, do you see anything else? Am I missing anything? Chat. Sorry, I have to look at both the Q&A and the chat.
There are a couple of others here.
And then when I'm sharing my screen, I get lost in the, so that's why John's helping.
Are there certain types of seizures that are more prone to having depression issues?
Well, so that's interesting. So we commonly, it's probably a little bit of a complicated answer, but so in adults, probably the most common type of epilepsy that we see as far as focal epilepsy goes, if you guys are familiar with focal, where the seizures are coming from one area, generalized where they're coming from the whole brain. Temporal lobe epilepsy can definitely be associated with an increased risk for mood disorders. But really all types of epilepsy can be. The temporal lobe, though, is kind of where some of those primitive emotion centers are. And then our frontal lobes, anytime you have seizures affecting areas that are strongly correlated with emotional regulation, there's some increased tendency.
Okay.
Good question. So I was showing you about all the changes that happen in our brain, real stream effect on the rest of our body. Psychogenic or functional seizures is kind of the newest term, are basically seizure-like episodes that we think are linked to psychological stress and trauma, or we know that they're linked to a history of those things. And there are a number of patients who have both epilepsy and functional seizures or psychogenic seizures. So we know that there is some kind of underlying link for some patients. I think, to me, what's interesting is this understanding of the effect that stress and trauma and those types of things can have on our brain. And we have studies that show that that can increase to the development of epilepsy as well. So I think that the take-home point for me is that this underlying effect on our brain from stress and trauma definitely has impact and can lead to both epilepsy and psychogenic seizures, and for some people both.
Okay. Another one here: is regular exercise helpful? I have found since my temporal lobectomy, running has seemed to help greatly.
Yeah, so there is a number of studies looking at the effects of exercise on brain health. Most of them are primarily looking at the effects of exercise on other neurological disorders like dementia and things like that. But you can kind of extrapolate that to epilepsy because, again, we know that a healthy brain improves epilepsy, right? So exercise has definite benefits in brain function, and actually in the studies with looking at the benefits of exercise in patients with dementia, they specifically look at temporal lobe function and temporal lobe volume. So exercise can actually increase temporal lobe volume. So can meditation. So it's kind of crazy, I think, that we're learning that we have these other tools we can use to improve our brain health. So I would say that makes total sense. Okay.
With depression issues, is any type of exercise, is it true that the myth actually is if it's something is better than nothing? Like going out for a walk is better than not doing anything at all, even though you might not be getting a full workout. Is that true?
Absolutely. Every little bit helps. And, you know, just even, so of course there's the movement aspect, that kind of thing, but there's a lot of other things that happen when you go out for a walk too, right? There's the fresh air, there's kind of being in a more natural surrounding. So all of those things definitely can improve your state of mind. And I always tell my patients, don't be too hard on yourself about exercise, because if you go out and you take, you know, a 2-minute walk, if you didn't take it, and you're usually doing nothing, that's 2 minutes more than you were exercising the day before. So every little bit counts. Absolutely.
Okay. When looking for a therapist, are there certain specific key points I should be looking for as I'm researching them?
So I usually recommend reading the bios, because I think that can help you at least pick maybe a couple of people that stand out to you as being a good fit. I think most therapists, I've helped patients go through bios in my office. I think most of them do a pretty good job kind of explaining what their areas of interest are, what they specialize in. A lot of them have areas they specialize in. So I think reading the bios is a good place to start. Talking to your neurologist or your primary care doctor, because a lot of times they will have familiarity with people that may be local, that other patients have had good experiences with. I know for myself, I keep like a little list on my desk when a patient tells me they're having really good success with somebody. And so that way I can recommend that person to somebody else. So I think those are good places to start.
Okay. This one is a little off what we're talking about. I'll ask it anyway, though.
Okay.
If I had seizures 30 years ago and then all of a sudden 2 in the last 6 months, did that mean I automatically have epilepsy again?
So 30 years ago was the
30 years ago.
So the definition of epilepsy requires 2 unprovoked seizures. That's what, and in our terms, that means 2 seizures that were not caused by something specific, like you know, a low blood sugar or some kind of something like that. So 2 seizures, even if we took the third, now I don't know the specifics of the story, but even if we took the seizures 30 years ago out of the picture, 2 seizures without a specific provoking cause would meet criteria for a diagnosis of epilepsy.
Okay. Okay, I think we're gonna have to end it there. That's about all we can take for tonight, but let me just reiterate what Alicia had said earlier. If
I'm
you
here,
have
John.
questions-
I'm sorry. I just want to quickly say, Dr. Schneider, now I'm having computer issues. So can you guys
It's
hear me?
one of those nights. Oh my goodness.
Sorry, John, go ahead. I just wanted to say that I am here.
That's okay. For those of you, I'm going to type it in one more time here. Let's see here. I'm going to just put down the email again up in the chat box. For those of you that did not get your questions answered tonight, please go ahead and submit them to the email I just typed in there, and that is connect@epilepsywisconsin.org, or feel free to call us if you prefer, and typing the phone number in there again. And we will get the question to Dr. Schneider, and she will submit the answer to us, and we'll get it back to you.
Yes, I'm happy to answer questions, guys. I'm sorry about all the technical issues.
Again, we apologize about tonight, but thank you, Dr. Schneider. That was wonderful.
Yes, thank you so much.
Appreciate
All right,
your time.
thanks, guys. Have a great night.
You too. Thank you.
All right, bye-bye.